My name is George Wittemyer, Wittemyer. It started in June, and I could not even walk up my driveway, and I knew something was wrong. And I have my daughter's a physician and my sister-in-law is a physician, and they of course didn't want to assume that I had any problems, so they said, "Oh, I think it's asthma," and I have had asthma as a child. My internist is Dr. Kono, and he is just great. He'll go to bat for me, and in fact, if it hadn't been for him, I would have never gotten to the hospital in time, because he finally, I think, talked to Melora and said, "He's got more than asthma. You've got to get him into urgent care immediately." The question became whether I would be a candidate for the LVAD, as they call it. I call it the turbine. It's the left ventricle assist device, and it literally is a turbine. And I wasn't sure I wanted to be, because I was already I was dying, and clearly. Shin did miraculous stuff, the surgeon, and of course the two cardiologists were Morrissey and Jacobson. They were there, telling things that this is good and this isn't good, and so on and so forth. Anyway, long story short, I did survive. Dr. Shin is probably close to being without peer. I mean, he's just an incredibly good surgeon. And the nurses at Kaiser, in fact, maybe every place, I've probably underestimated nurses all my life. They are just a fantastic group of people, and they know so much. They're really very knowledgeable, and these people are so helpful. There's two nurses in charge of the program, Barbara and Pam, and they're both magnificent. They are the juice that makes the whole thing run. Pretty soon I started driving one of the tractors, and then I started shoveling gravel and cutting trees. I mean, I just started going back to being a normal person. Here I am, thanks to Kaiser and those marvelous physicians they have. And I'm on bonus time. There's absolutely no question about that. And I'm really happy.